So really good to follow on the piece around innovation, lots of research evidence being generated, and actually, well, you take for yourself what the message is from this when you get to the end of it, but the really key point for you is that wherever you are in your journey, whether you're planning to study and become a health professional, whether you're in the middle of your training already, whether you're already working in the NHS, the fact is that evidence does not speak for itself. It needs to be mobilised at the right time and through the right people to make a difference in decision making. And that right time and the right people comes down to every one of us in this audience today, as well as those who work specifically around the areas of generating evidence or seeking to implement it. But first of all, I'm always curious as to what brings us to our choice of career. It's an interesting question to ask people as we work through the days in the NHS. So a little bit about my story. I grew up in the Medway Towns. I grew up in Rochester, a lovely city, cathedral and river. This is what it looked like in the 1970s. Charles Dickens lived in Rochester, and in his writing he drew on his observation. Then, as today, there were pockets of disadvantage, and there remain significant inequalities across the area. So the thought of training as an information scientist first came to me actually when I went to visit an exhibition about the new bus routes. And what dawned on me was that the pockets of Dickensian disadvantage were not actually being advantaged by the new bus routes. And I realised that some residents were going to be much more severely affected by these changes than others. And I wondered how far the information about these changes would be reaching my fellow residents who were likely to be affected in that way. So I was thinking about information and decision making and influence and engagement. I mean, when I was at school and I was learning about Chadvara, now one or two of you, if there are any trainers and parents here, might know that Chadvara was the script writer for the Eagle comic. He was also the founder of the Samaritans. And what was his why? Why did he do that? Well, he was a reverend, and the very first church service that he ever took as a newly ordained vicar was for a 14-year-old girl. She had started her periods, she had no idea what was happening to her, and she was so afraid she committed suicide. And Chadvara decided he would then and there dedicate his life to helping people contemplating suicide and to sex education. But for me, what I was seeing was the penalties of ignorance in our very privileged society in England at the time. How well do we really share health information now? What do we know about it being understood? And my drive became around supporting healthcare staff and policymakers and providers and patients to use evidence to make informed decisions to improve healthcare. That's the reason why I came into the health service as an information specialist. I'd done lots of other things before. There were lots of doors, and the NHS opened new doors for me. And if you're thinking this doesn't apply to you yet, hang on in, because I've got some really interesting statistics to show you in a moment that relate to your chosen career pathways and to the work that you may be doing, or indeed may be doing now. So I joined the NHS as a health education and information officer. I'd done a bit of research first. I'd worked for the professional body first. I went into a local training practice, general practice, to give them a bit of advice on how to organise their collection for students and trainees. And I came out with a part-time job. And over the next 25 years, I worked in primary care as a knowledge manager, a chief knowledge officer. I became a director of a clinical commissioning group. And as I saw the challenges around spreading innovation, it's tough to spread innovation around the coast from Bournemouth to Eastbourne. It's really tough to spread it around the country. It's tough to implement best practice, and it takes years. Standard view is it takes about 17 years, and we've seen huge changes in that around the last few months during the pandemic, opening up opportunities to move much faster. So, as I moved along, I became more and more interested in the human factors of change. How are we going to bring evidence to bear? And I became interested in quality improvement tools and techniques to do that too. The last 5 or 6 years I've focused as the national lead for NHS libraries. I've worked for HE, already been said, and I have a funny team who are looking at how, whatever they can do to make sure that we use the evidence. So wherever you are today, there are 350 careers in the NHS. And whether you're at this stage of being curious about whether you want to pursue a career, or whether you're studying, you've got exams to do and assignments and professional assessments, or whether you're well into your track now and you're tracking towards training and qualifying as a health professional, or in the early stages of your career, maybe looking at research, all these issues around knowledge and evidence underpin all your work, and does that day in, day out for as long as you work in the NHS. So why does the NHS need knowledge specialists? It's all on Google, isn't it? It's all sortable, dead easy. So 8%, that's how much of the internet that Google searches. I do accept the fact that there's about 60% that none of us want to search, but about 88% is all that it searches. 7% of the searches every day are health related. And we have 2.5 million new scientific papers published each year. If you look up cancer in Google Scholar, you'll find 5.6 million results. Many more if you just look it up in Google. And the NHS interacts with 1 million people every 17 hours. I developed this campaign around #1million decisions about 3 years ago. When I did that, the NHS interacted with 1 million people every 36 hours. Now it's every 17 hours. So there are a hell of a lot of interactions, opportunities for people, patients, citizens, health professionals to interact in the long-term interest of health and care. But there's a gap between research and practice. Now this comes from some work by Hardcastle just a few years ago, and it's based on looking at a cohort of 16,000 people, all of whom have one or more of these 4 long-term conditions. So they looked at the treatment that these folk received in relation to a defined set of quality indicators for healthcare. How good is the care that people are getting? How far does it match what we know about the best care we could give? So if it's cardiovascular, that's fairly sexy, isn't it? And you're looking at, you know, really good figures there up into the 80s. Come back down to diabetes, much talked about during the pandemic. You can see just over 70%, a little bit lower if you're looking at a particular bundle of care quality indicators for diabetes. Depression, 60%. So by now you're wondering whether you want to be in the 40% or you want your college friend, your school friend, your mother, your father to be in the 40% that is not getting care to the very highest quality that we can give. And come down to osteoarthritis, and we're starting to think about how my knees are going to fare through the next 20 years, and you're really looking at 38% of patients in that cohort of 16,000 patients with osteoarthritis received care that matches that standard of evidence-based care. Now, there are many, many reasons why you would or wouldn't get 100% of this. It's not, you know, science, medicine is an art as much as a science. It's matching the needs of the individual and a whole range of other issues. Nevertheless, when you're talking about the 60% and the 38%, we should all notice and think about what our role and responsibility is in starting to address those kinds of figures. So, implementation, knowledge transfer. This is a picture of the Topol Review. If you read nothing else this summer, I invite you to read the Topol Review. It was my privilege to be the programme manager for this piece of work. It is about preparing the healthcare workforce for the future, and in so doing it is about the kind of future of healthcare that any one of us as patients or service users might want to may experience. It's an exciting document, it's readable, it's brought alive by personas of some key healthcare professional roles. It's brought alive by examples of the kind of productivity changes we might make by applying AI technologies, genomics to the way that we work. It is your future, so please tuck into it. It's a great document. I've put the link there. And it talks about the adoption of digital healthcare technologies being grounded in compelling real-world evidence, not huge longitudinal trials. How are we going to find the right kind of evidence so that the things that we invest in as a healthcare system really deliver on clinical efficacy and really deliver cost effectiveness? And what are we going to use in terms of tools and techniques to make sure that that kind of practical knowledge transfer can happen across the NHS, across all the people involved in the care pathway, from one organisation to another, from one place that didn't invent it here to another place that didn't invent it here? How do we manage to get that real kind of flow and implementation of best practice? So do read that. It's a great document, and it starts to really point to why the importance of knowledge underpinning our development into a 21st century service is so crucial to the implementation of change and best practice. Meanwhile, for those of you who may already be training or practicing in the health service, and for those of you thinking while you're out and about and looking at the people around you, or if you're still shielding, connecting across the internet and connecting with colleagues and looking at Zoom and looking at your friends, you know, we really need to get a grip on how far we're understood as health professionals. So let me remind you that 16% of adults in England are functionally illiterate. That means they're operating with a reading age of age 11 or less. 42% of working age adults are unable to understand or make use of everyday health information. People actually struggle with basic anatomy and working processes, and of course when you're feeling unwell it's even more difficult to take this information in. But that rises to 61% where numbers involved. And so what you see is really practical applications of this, that 43% of adults struggle to understand instructions to calculate a childhood paracetamol dose. So I hope people are shocked looking at this, because I'm in the business of information, implementing evidence, wanting us to communicate really, really effectively. And amongst the sort of portfolio of projects that I do, we bring in the 24/7 access to best practice through the system. We buy BMJ Best Practice, a clinical decision tool. But our projects run right the way from that part of the spectrum, serving highly educated, highly literate workforce, through to how are we going to work and help to work with other information providers, pharmacists and community pharmacy, people working in public libraries, people looking to do social navigation, social prescribing. How do we help them understand and use some really practical tools and techniques to make sure that they're well understood by patients and service users? So the spectrum of work of knowledge services and information work in the NHS is huge, and what we are always wanting to do is to work through the 1.4 million of the entire workforce through our services. We've got 1,200 people working in library knowledge services in the NHS in 185 services, and increasingly you're seeing people work as clinical librarians embedded within clinical teams, and as knowledge managers embedded in other in managerial functions, in fact. So I've given you a bit of a taster of what the spectrum of the business is. And so what's the solution? Well, the solution is a whole range of ways in which we look to help the workforce apply and use evidence, how we can help them build know-how, how we can help you continue to learn and drive innovation following on the presentation, before looking at the spread and adoption of innovation. And there's a whole range of ways of tackling that and different sets of skill sets. So while I might talk about librarians and knowledge specialists as if they're one thing, the 1200, actually they range from people who are able to manage corporate knowledge and evidence at one end, to people who are really classy at searching in another, and I'll come back to that thought in a minute. So in the Topol review, that's named after Eric Topol, professor from the States who led this extraordinary piece of work, the recommendation is that we will need a whole to increase the number of knowledge specialist posts in order to be able to support the technological innovations that we anticipate. And those librarians coming through and knowledge specialists coming through, particularly we see a need for those embedded roles that I've just mentioned. Why? Because they do faster, better information searches. They can help us manage that extraordinary information overload to which I've already pointed. They have skills in synthesizing and summarizing evidence, have skills in facilitating conversations, helping people share learning, share their know-how. And that's been incredibly important this summer as we've looked at helping people learn the lessons. At places like the London Nightingale Hospital, people were using lessons learned techniques on a daily basis as they were setting that facility up. And across teams, looking at primary care, which has gone really digital, etc., etc., you're looking at a whole range of people wanting to capture the learning and then turn that into actionable results. And there's a shed load of tools and techniques that we share as knowledge specialists to help people do that. And that's, of course, without the massive amount of horizon scanning and helping people keep up to date. Do a big survey of NHS staff, and the two key pieces of knowledge, and one is that keeping up to date in your own professional piece, and the other is knowing that you've got the evidence coming through when you need it. So those are some of the kinds of tools and techniques that we would use to mobilize knowledge. They're really quick reference cards, they're practical tools. Actually, the answer really is on a postcard. You can run an after-action review or a peer learning event just from that. And, you know, my message is that whoever you are, whatever your profession, there are tools and techniques here that you can use. Reach out to your library and knowledge services. There are many roles, many different types of roles, but if you and I've listed some of them here. So we've got library assistants, and we've got people coming in on a level 3 apprenticeship. We're looking to develop level 7 apprenticeships. Most of our people come in with a postgraduate qualification in library and information work or information science or knowledge management, and have a range of skills and expertise that they bring to the party as evidence specialists or embedded roles, as I've discussed. And there's work around patient information, of course, as you'll have heard me describe, mostly looking to work through other information providers. So right now, I've got a body of experts out there who know how to detect bias in published literature. But of course, what we need now is a body of people who can detect bias in the algorithm that underpins the filtering and the searching of the evidence, which we will use to bring to bear. So got our first people in who have done their dissertations. I've got one person doing a PhD in AI, and I'm chairing a programme of work for CILIP, which is the professional body, Chartered Institute of Library and Information Professionals, looking at the implications now of the new technologies on the practice of information professionals, actually across the whole sector. However, the thing to say is that we are the most exciting sector in our profession. It is all about using the right knowledge and evidence at the right time, in the right place, and that is our business for all of us. So whatever you're looking at, whatever your career is, or whatever you see your career path starting out as, because they take many different journeys as mine did, knowledge and evidence, being effective in communicating, are all critical to the role that you will be taking or are taking. And if you should happen to be somebody who's an aspiring knowledge specialist, keep your eye on NHS jobs. if you would. To find out more, there's a couple of different animations there. One is around the role of library and knowledge specialists, and one is around the impact they make to the bottom line of healthcare, the bottom line of the quality of care that any one of us receives, and of course the bottom line of working in a productive and effective way. Take a look. Thank you for staying with me. Thank you for your time.